The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Welcome to the Dr. Fazil Show. My name is Jose. We have award-winning Dr. Fazil here with us today. He's won an award for top nephrologist for 2020, most compassionate doctor, and he's won the Patient Choice Award as well. Thank you for coming today, Dr. Fazil.
Thank you, Jose, for having me in your show today.
Dr. Fazil, we know that you've been in private practice for multiple years. We wanted to ask you about the coronavirus epidemic.
Okay, so Jose, thank you for asking that question. It's a very important question now. The nation, the world is suffering from pandemic of coronavirus. It's just the tip of the iceberg, I can tell you, because it's still spreading and we don't know where it's going to end. But the goal would be to prevent it. And prevention is the key at this time since we don't have any cure or vaccination with this coronavirus.
And how can patients prevent it? Best way they can prevent it.
So the coronavirus spread through two means. First is through the cough droplets. So it's kind of like airborne, but it actually have to go through the droplets of the patient, infected patient to a second patient. So social isolation is the key. 6 feet or more distance between individuals will prevent it, or staying at home if we can to avoid communication or transmission of infection. Also, we know that you can stay on the surfaces of the objects up to many days, up to 9 days. So that's another way it can spread. So if you touch your hand to an infected surface and then touch your nose, or eyes or even mouth, it can be transmitted that way as well. So obviously sanitizing your hands or washing your hands with soap and water before you touch your nose or eyes or mouth would be a key factor to prevent the infection.
And Dr. Fazil, is there any vaccination or treatment available at this time?
Well, that's a very good question, Jose. So at this point, the FDA and the healthcare agencies are actively working on different models of treatment. There's some medications which has been proposed, and they're experimental as far as the treatment of coronavirus is concerned. Hydroxychloroquine is a medication which has been used for years for malaria prevention or treatment. And also Zithromax has been proposed yet, but we still have to see a bigger study to see the effect. There are some other antiviral medication as well. They're being in trial phase, and there's no vaccination at this point. Vaccination might take a year and a half before it becomes available because it needs to be given to healthy people, and we want to make sure that the vaccination is safe before we start to inject or give vaccination to those unaffected patients in hope to prevent it, as it can cause more damage than good if it has any side effect, which we don't know at this point.
And what kind of masks are recommended for prevention of coronavirus?
So there are two kinds of masks. One is N95 and one is surgical mask. N95 is the mask which will actually prevent or disinfection for transmission through the respiratory means. Surgical mask is not going to prevent because the viruses will still go through the surgical mask and cause infection. Surgical mask is probably only effective if you do have infection yourself, and then if you do want to cough, then it will prevent the cough. Instead of going in the front, it will go in a different direction. So it will prevent infection to another person, but not getting infection yourself. If you don't have infection, the surgical mask wouldn't help. You need N95 masks, which are designed to prevent infection like this. And unfortunately, they are in short supply at this moment.
How can patients get the mask?
Well, the government is working on it. Different private sectors are working on producing it in mass quantity. So hopefully in a few days, we should have it. The healthcare provider should have it, and the private public sector will have it. But at this point, we're still waiting for enough masks to be available to be given to everybody in the country.
And do you know where the coronavirus originated?
Jose, I will call it Chinese virus. I think it is the Chinese virus made by or came from China or Chinese.
Right.
Because if you look at the makeup of the genetic makeup of the virus, we can easily tell it came from the bats. And the first ever case is reported, which should have been reported rather early, was from China, and seems like it was the bats, infected bats, and their blood got to the people in animal market, which were filthy, and then they got sick, and then it got spread from one person to another person, and early intervention would have prevented it, but that step was probably missed or delayed, and it caused worldwide spread because of the global travel, people flying through different flights, going quickly, rapidly from one place to another place, and and since it's very contagious, and it got spread to almost 150 countries now, 150 countries. So it's a Chinese virus.
And how is it different from the common flu?
Well, common flu used to be like this virus back in the days earlier when the flu started. For example, Spanish flu in World War One. We call it Spanish flu, but it was not. It was not actually Spanish flu. It didn't come from Spain. It actually at that time in World War One, people were getting it from everywhere, but the media was being censored because the countries who were in war, they didn't want the enemy to know that they have this deadly virus going around in their country, and they were hiding it. Spain was the only neutral country which didn't have, in which the media was not censored. So they were saying, "Hey, there's a virus going around. There's this disease going around, flu, which is causing a lot of fatalities." Since they were more open to communication and public awareness, people named it Spanish flu. So that's actually a misnomer. Didn't come from Spain. Spain was I will call them a whistleblower. They were the whistleblower, and they named it Spanish flu. It was not a Chinese virus. It was just the media which educated the world at that level. Hey, there's some kind of virus infection going on. And again, coming to your question, like, is it how is different from flu versus not? Well, the difference is that it is very contagious, and we don't have any cure at this point, and we do not have vaccination at this point, and it does not cause body aches or myalgia as the common flu will cause it. It does cause dry cough, fever, and respiratory symptoms. Now, if it goes deep enough into your lungs, it can cause shortness of breath and even death. That's why there's a dire need of ventilators in the country. We need to have ventilators. If the patient if patient do go into respiratory failure, and they will need to be on the breathing machine like ventilators, and that's how it affect the lungs and the upper respiratory tract part of the body, and that's why people get into respiratory failure and shortness of breath.
Thank you for spending your time with us, Dr. Fazil, and educating our viewers. viewers, stay tuned for our next episode where Dr. Fazil will educate us more.
Thanks so much, Jose, for having me today on your show, and thanks so much, audience, for watching me today. And we'll be giving you more information on this deadly disease in the next episode. Hopefully, we find a cure soon from this Chinese virus. And please stay safe. Please stay safe and follow the precautions.
Good.
God bless America.